Scott just made
Go
the
back to
point.
Thomas
Jeff
Jefferson,
Jefferson
you'll
used to
read
be a
that-
lot more secure, not just. I'm Steve Green, and this is a special three-part trifecta getting you updated on a story we've been covering here since 2009. It's called Obamacare. The good, the bad, and the ugly. Now, to tell you the truth, I'd sworn off doing even one more Obamacare report after doing so many over the years, but the big headlines, they've been stacking up my browser for weeks now, and it's time to break the embargo. So with me to do just that, Bill Whittle and Scott Ott. Gentlemen, it's not all bad news, believe it or not, for the totally settled law of the land, although to be fair, it's probably difficult even in Washington to spend $100 billion a year without some positive result. And here it is. At Mother Jones, Kevin Drum reported on Monday that Obamacare is beating its goal of reducing the number of uninsured, which now stands at a record low 32 million Americans. Bill, that's a decline of more than 10 million uninsured Americans. So why do you want millions of Americans to lose their coverage that they always needed but have only thanks to Obamacare?
Because people used to pay $330 a month, and now they're paying $1,400 a month. That'd be a place where I would start, for one thing. Yeah, it's amazing what you can do when you basically do something like that to the American people. Think of all the uninsured people we could be covering if we started paying $6,000 a month in premiums, each individual family that was paying $300, $350 before. So let's just start there. Secondly, as somebody who was dropped from my private health care insurance, which I liked, and the doctor, which I liked, which I was told I could keep, but I can't keep anymore, let me tell you that you cannot reinstate yourself for insurance until January, not in California anyway. So I got dropped from Blue Cross, and then I had to wait until January 1st to get insurance coverage again through the Obamacare exchange. However, fortunately, I was able to get a stopgap insurance policy that costs 3 times what my old policy cost, doesn't cover any pre-existing conditions and all the other lies that we were told about this giant, magnificent program. And you can fake these numbers and say what you want to about all of them, but without question, Steve, in terms of the money we send $1 for health care, we get 33 cents of health care back. It would have been much cheaper, much better, much freer, and much more cost-effective to have bought every single American who wasn't insured a private Cadillac Gold health care program than what this thing is costing the American people, and this nightmare is just getting started.
Oh, Bill, you just can't take good news. That's your problem. You know, that's not to say there isn't a long way to go. Despite what Bill has you believe, there are still almost 33 million Americans without coverage. That's a big number, 5.5 years after Obamacare was signed into law, and 2 years after those exchanges opened for business, where Bill has had such good luck shopping. But there's good news even in the bad news. Of those 33 million, more than half qualify for subsidies on the Obamacare exchanges or could get covered by the big Medicaid expansion included as part of the law. Scott, if conservatives really are caring, if we really care, shouldn't they and you and me, shouldn't we be helping people to sign up for the health care benefits they're already entitled to under the law?
Yeah, it's a darn shame that we haven't heard anything about that. Like there haven't been any public service announcements or things on the internet or Twitter or Facebook or Instagram or SoundCloud or whatever else, you know, or Zach Galifianakis interviewing the president of the United States between two ferns. There has been so much publicity about this. Here's a free product you can't sell. I mean, what the heck is going on with this? And like Bill Whittle, and I didn't even realize this happened to Bill, but Stephanie and I, my wife and I, both had separate privately purchased health insurance plans, both of which were dropped because of Obamacare. And then when the insurance company said, okay, we can get you this stopgap policy that costs more than the previous policy, who has higher deductibles than the previous policy. And so we got nailed in the same way at that time and I can't imagine how many other people went through this. And it's almost as if there needs to be some sort of support group network where we can all get together and sit around in a circle and go, hi, I'm Bill. I was forced into Obamacare.
Yeah,
I mean, this is a disaster on wheels. And if Republicans were compassionate, they'd do everything they can to free people up to make their own health care choices. And like Bill said, we'd be better off to hand out $100 bills in the streets.
That support group should be called a constitutional convention. That's what we should call that support group. And we should go in there and make this thing illegal. Now, I know you're playing devil's advocate here, Steve, and I'm sorry to jump back in again, but look, anything that looks like good news for Obamacare is bad news for the country, because what you're basically saying is if these numbers are increasing, if more people are being insured, or the number of uninsured people is going down. You put it any way you want to. It's going down because the law is forcing somebody else to pay for my health care, right? And it's evil and it's wrong. We have trillions. What's the debt now? $20 trillion? This can't continue. And anytime it looks like it's getting better, it really means it's getting worse.
Bill, my fellow friend of Barry O., there's plenty of bad news buried in the good news. Folks, Kevin Drum cited that CBO study, which Obamacare might beat next year. But the CBO fudged its own numbers. Brian Blaze reported for Forbes last week that right up until 4 months ago, when it was obvious Obamacare was never going to reach its goal for next year, the CBO cut its projection in half from 20 million covered to just 10 million. Other organizations like RAND and the Urban Institute thought the number of enrolled would be even higher, 23, 24, 25 million enrollees. Right now, the number stands at 9.1 million covered on the exchanges. And when you discount the 7 or 8 million who are only on the exchanges, like Bill and Scott, because they lost their insurance because of Obamacare, it's clear that virtually all of the increase in coverage is due to the expansion of Medicaid, of welfare. In other words, Barack Obama and Nancy Pelosi and Harry Reid were only able to increase coverage by expanding welfare to people making 4 times the poverty level. In other words, Americans will gladly take something for nothing, but they won't buy Obamacare unless they're forced to. And that's the good news. We'll get to the bad and the ugly coming up in our next 2 reports. For Scott Ott and Bill Whittle, I'm Steve Green.